The rich history of this institution benefits everyone. There's a real sense of pride. We're the beneficiaries of over 130 years of enormous effort that's gone into getting the building blocks in place to where we are now. We need to celebrate those wonderful people that have allowed us to do the things that we've been able to do.
I'm just so proud. Tears come to my eyes to see where it came from and where it is today, and I can see where it's going.
The school was one of the very earliest schools of pharmacy in the English-speaking world. So it was a very early developed school.
As sailing ships brought new settlers to Australian shores, so too arrived drugs and poisons. Although no established process of sale control and registration existed for these chemicals, from the 1840s onwards, Victorian chemists and druggists traded in Melbourne and in goldfield towns such as Ballarat, Bendigo and Maryborough. Anything from a respectable brick building to a tent served the medicinal needs of the burgeoning population.
Before pharmacy education got going, the profession of selling medicines was completely unregulated and not controlled by anybody. But there were some very dangerous substances that were just on the market, generally available to people. Mercury and arsenic and strychnine and opium. And governments around the world started to say, look, there was increasing numbers of suicides and poisonings and murders. So we said, we've got to control these substances.
Victorian pharmacy was a blank canvas, lacking both legal and educational framework.
All of the pharmacists that came to Australia in the 1800s were British trained in the main, and ultimately they realised that they'd have to start their own training, etc. But first they had to become a professional society, so the Pharmaceutical Society of Victoria was established in 1857.
So the society existed for a long time as a group of people who had the common interest of being chemists and druggists.
In 1870, the industrial chemist Cosmo Newbery began teaching general chemistry classes in the Industrial and Technological Museum, located behind the Melbourne Public Library. In 1871 and 1873 respectively, chemistry teaching schools opened in the thriving gold rush towns of Ballarat and Sandhurst. In 1876, the government of the new state of Victoria passed the Pharmacy Act and the Sale and Use of Poisons Act. In 1877, the Pharmacy Board of Victoria was formed to administer the new acts and to oversee the chemists and druggists profession for the public's interest. Pioneer Victorian chemists and druggists, later to be known as pharmacists, imagined a pharmacy school modelled on those in Great Britain, involving apprenticeships and laboratory classes. Their determination for the profession to flourish was to be a constant in the future.
The board said to the society, can you arrange for these apprentices to be given instruction in these things? First of all, it approached Melbourne University. It had no particular interest in providing its own school. And after a long period of negotiations, for whatever reasons at the time, the university declined to do that.
So, in 1878, frustrated by the delay, Society member John Crews began offering pharmacy classes at his home in Hanover Street, Fitzroy, naming it the Fitzroy School of Chemistry and Pharmacy. Crews taught elementary and practical chemistry, materia medica, pharmacy and botany, the subjects specified to be taught by the new Pharmacy Act. By 1881, the school at the museum also taught pharmacy subjects and was officially recognised by the board as the Melbourne School of Pharmacy. In 1882, yearning for its own home, the Pharmaceutical Society of Victoria paid £400 for the old County Court building. Located at 360 Swanston Street, the new pharmacy school was ideally located in the heart of the city. John Crews was appointed Foundation Director of the Melbourne College of Pharmacy. The vision was realised. Finally, the growing population of pharmacists had their own institution. The college's scope also extended to teaching medical students and others who worked with chemicals. Significantly, the building housed the offices of the Pharmaceutical Society of Victoria and the Pharmacy Board of Victoria. The co-location of these education, professional and regulatory entities would continue for 125 years.
That's how this whole relationship between the Pharmaceutical Society, the college and the Pharmacy Board was established.
Those three grouped together were a powerhouse in Australian pharmacy.
It's presented itself as consolidated I think, because of that, and not easily able to be split. Divide and conquer's been the oldest rule in the world if you want to overcome someone.
With tenacity and solid foundations, pharmacy education continued at Swanston Street for many years. A new wing was added in 1913, and in 1920 the college appointed its first dean.
The dean was A.T.S. Sissons, known as Sisso, and he was dean from 1920 to 1962, believe it or not. That's a record which will never be broken.
And the next year, the college was renamed the Victorian College of Pharmacy. Stan Sissons, former science master at University High School, passionately led the Academia of Pharmacy Education in Australia for 4 decades.
He started to bring pharmacy out of just a vocation that was taught by apprenticeship into the beginnings of the scientific era.
Sissons presided over a time of great political upheaval, starting at the end of World War I and continuing through World War II. Delivering education was challenging, with many staff, students and pharmacists recruited to the war. Dean Sissons and the profession closely supported the soldiers and their families.
Mr. Sissons, who had trained my father, took me under his wing and he looked after me. I was accepted as being somebody that was part of the pharmacy family.
Sissons wrote regular letters to the frontline, and the many pharmacy casualties affected him deeply. In 1942, the Pharmacy College Comforts Club was established to send parcels to serving pharmacists. Creams were made for the Red Cross, and Christmas gifts were sent to children of pharmacists who died in the war. In 1943, with many men at war, Sissons asked academically gifted Muriel Witt to lecture the students. Miss Witt was the first female member of staff. After the war, Sissons sourced funds for training for ex-servicemen and women. They were preferentially accepted into college.
I started pharmacy in 1948, which was just after the war, of course, so there were 20 students from school and 120 ex-service people.
The first day arrived, and we were met by a gentleman called Norm Coe, known as Snowy Coe, because he had this white hair. He just did everything. He started as a lab boy, I believe, when he was 14, and he was really gruff, and everybody was terrified, but he had a heart of gold.
We were treated as individuals. We weren't treated as a sort of mob. When I did my final exam, and I was making an emulsion, which I shall never forget as long as I live, and somebody came up to me and said, "Here's a bottle, here's your ingredients, start again." Which I did, and it worked the second time. But they were the sort of things, people knew you as an individual, and I guess it might be the same, but it was very individual, and it was fun.
Apprentices would work with their masters for the week and then come in, say, to a morning a week, 2 or 3 mornings a week.
Because it was an apprenticeship course, you had to rush back and forth between the pharmacy, where you apprenticed, to the college. So it was really hard work.
We didn't have the same sort of time together as students. There were only a couple of days a week you could wander across to the Oxford and have a drink after college, because we mostly went back to work.
The 1950s and 60s brought new challenges. Everyday pharmacists were blindsided by the deluge of mass-produced drug company products.
Medicine was about doctors selecting doses and individual medicines to be mixed up to a dose form. What was coming in, and it was coming in so rapidly, was the pre-prepared medicines by the pharmaceutical industry. And that was the role that we weren't being prepared for, I don't believe.
The thing about the course I did, it virtually hadn't changed in 50 years. In those days, we were trained to practice in the 19th century.
It was mainly an exercise in memory, where you never really learnt how things worked or why they worked or why they might be effective as medicines. For our final exam, we had to be able to identify about 150 different medicines, tinctures and solutions and so forth, by their smell, by their taste, by their look, by their feel, and the doses of each one. We had to know that off pat.
I probably say that a lot of medication probably you would have got better with if you didn't take it. Some of the mixtures we prepared. I remember one day I got a prescription when I was apprentice, and it had MIST, meaning mixture, ADT. So I rang the doctor, very jovial fellow, and he said, "Oh, you're new on the patch." I said, "Yes, sir." And he said, "No, you know what it means?" I said, "No." He said, "Any damn thing."
But apart from overhauling the curriculum, Sissons also wanted the facilities to be worthy of the craft.
It was a funny place. It was quite dark and old. A rabbit warren, the old building, had been added to and developed over many, many iterations. The laboratories were malodorous to the greatest extent. The chemistry laboratory had H2S, which is rotten egg gas. That was the pervading smell through the whole building. The wastewater from the upstairs laboratories used to splash down into troughs that ran along the ceilings.
They had an appeal to raise funds to transfer from Swanston Street to the site here in the late 50s.
Eric Scott, president of the Pharmaceutical Society, and his protege Nigel Manning, president of the board, formed the heart of the fundraising committee.
So Eric Scott was a larger-than-life character. He was knighted eventually for his work in pharmacy.
He was a former Victorian boxing champion, Essendon footballer, jackaroo and hotel keeper, and had a close relationship with Sir Henry Bolte, the Premier of Victoria at the time.
The dean of the school here rang up and said they wanted another $100,000. Could you get in touch with Sir Henry Bolte and see what you could do? So he walked in. Bolte was surrounded by a few of his ministers, and he looked up and he said, "What do you want?" He said, "I want some money." He said, "You can have a drink, and that's all." So a couple of the ministers came and said, "Get stuck into him, he's been grumpy all day," and so forth. Anyway, after a period of time, Sir Eric said, "Look, I've got to go, I've got a family to go." "All right, with you fellows, blah, blah, blah." And he said, "What do you want?" He said, "I want 100,000. Turned to a bloke and said, "Write out a cheque for him in the morning."
For £25,500, the Pharmaceutical Society purchased land in leafy Parkville and construction commenced in 1958.
The Pharmaceutical Society owned the college, and it was their college. They'd paid for most of it. Most of the money that was raised to create this campus, a big proportion was by an appeal to the pharmacists of Victoria, who gave generously. So they were fiercely proud of the institution.
The chemist subgroup of the Returned and Services League was a primary donor to the War Memorial Building Fund.
I can remember the opening of the college. My father was the president of the Chemists RSL. The governor of Victoria opened the college, and Dad was the master of ceremonies because it was a War Memorial College.
Henry Francis, where my grandfather was still senior partner and my father was the driving force, donated £25,000.
The Assembly Hall was later named in honour of the Cossar family's generosity and service to the profession.
I know that Nigel Manning was always keen to have this new college not only as a functional college. He insisted to the council that some money should be spent on adorning the place.
When I came to the college in 1961, the artist Len Anoy had already been appointed to do a large mural for the hall. Eric Scott, who was the head of the building appeal at the time, he was the one that insisted there be a mural, and Nigel Manning was very heavily committed to the arts.
The other part that they spent their money on was the beautiful marble entrance hall that was formed into a war memorial with the memorial book, which is produced for the people who served in the First and Second World Wars.
The Victorian War Memorial College of Pharmacy, as it was officially known, was opened in 1960, and the staff and students eagerly moved from the old building in Swanston Street to the new building in Parkville.
At the same time, the course ceased being a 4-year apprenticeship course with lectures during it to a 3-year full-time academic course with a rejigged curriculum.
New lecturers were also recruited with degrees higher than bachelor, representing the beginning of the new academic approach. In 1962, Sissons retired from his 42-year period as Dean, making way for Nigel Manning.
It was a complete change over the next 10 years under the leadership of Nigel Manning, the new Dean.
Nigel Manning was really a visionary. Not an easy man to work with, but he was a visionary.
As a student, I came in just after Nigel Manning had finished as Dean. And his period of time as Dean really set this place up to be able to do some quite magnificent things.
He quickly saw that if it was to be anyway a scientific school, the school had to undertake research.
Manning sought grants and scholarships to allow research to proliferate.
Back in those days, we weren't supported by government, and the funds for that purpose all had to be raised privately.
In the late or middle 60s, the college was trying to get accreditation for having a degree course.
The qualification of the Victorian College of Pharmacy at that stage was your registration. There was no diploma, you didn't get a diploma, you didn't get a certificate. What you got was your registration certificate, but no academic qualification. We were doing a 3-year academic course, which was equivalent time to a degree, and we were turning out students that we honestly thought were equivalent to a degree.
After protracted negotiations and strong support from the profession, the college's dogged resolve to advance further succeeded.
So with a lot of fighting, we got there. We were the first non-university institution to get a degree in this country, and then with further work, the first non-university institution to grant master's degrees.
When we couldn't have a doctoral degree, we were very well known throughout the pharmaceutical education area worldwide, and especially at the University of Kansas. And so through the University of Kansas, we developed a joint program, the InterSearch program. That was our way we got into the PhD degree, and the universities were very, very jealous of the fact that the only institution that was going to ever grant a PhD degree.
The InterSearch program represented the entry point for students from the College of Pharmacy to begin attaining PhDs from a range of universities. Rapidly outgrowing the premises and needing research space, a building committee was formed and headed by Alastair Lloyd. With remarkable generosity again from the profession, construction on the 3rd building began.
The first 2 buildings of the now 4 buildings on the campus were called the Sissons Building and the Scott Building, after the 2 major people involved at the time. The 3rd building on the campus became known as the Manning Building to complete that story.
When I finished my PhD, it was December 1960. I put my thesis in on a Friday, looked at the Age on a Saturday, saw a job advertised at the Victorian College of Pharmacy. I rang up to get more details. They said, "Can you come in and have an interview this afternoon?" Which I did. And they rang me up the next day saying, "You've got the job. You can start on the 1st of January.
In 1979, after many years teaching, Jeff Vaughan took the position of Dean.
The focus of pharmacy was moving from supply to actually care, but that care also needed to have components of information that would enable the patient to better understand their medicines and to produce better outcomes, which is, after all, what it's all about.
People were starting to recognise that pharmacists were being really pretty underutilised. There was a history of pharmacies in hospitals being in the basement, locked away from everywhere.
They would be mixing up the disinfectant solutions and dispensing the medicines to go up to the wards to be given by the nurses. But our direct role in things like ward rounds and sitting at the bedside actually explaining the medicines to the patients, I think, has become just part of the service. Solving their medication-related problems in conjunction with the doctors and nurses who are part of the healthcare team has really been a maturing of our profession.
You can make the best drugs in the world. If the patients don't comply and they don't take them properly, the whole thing is pointless.
Neil Naismith was the director of pharmacy. We'd bowl into his office and say, "Got a great idea, Neil." And he was always supportive and allowed these things to happen.
It was the pioneers in hospital pharmacy that have led now to similar sort of services being offered in community. So the home medicines reviews, the services to nursing home patients, the meds check and diabetes meds check, those sorts of services have really sprung out of the services that were offered to patients in hospitals.
In the late 80s, Federal Education Minister John Dawkins sought to rationalise tertiary education by amalgamating private colleges into universities.
In some ways, the colleges were becoming something of an artefact or an anomaly in the system. Before 1991, there was a lot of discussion about where we would merge, who we'd merge with, and lots of discussion with the University of Melbourne, a logical partner just down the road from the Pharmacy College. And the discussions went on for quite a long time, trying to find the right fit.
We went in and out for some years. Going into meetings, we'd come back, we'd have another meeting. We wanted to retain our identity.
It culminated very much when, between meetings, we went from a promise to go into a faculty of medicine, dentistry and pharmacy to be told we're going to go into a faculty of medicine, dentistry and health sciences. And we felt that was an ominous sign for the future.
We would not have had representation sufficiently from pharmacy in that mega faculty. Our whole voice would have been lost.
Jeff Vaughan had moved to another institution. This decidedly formative period came with great uncertainty. So the college sought a strong leader. Emeritus Professor Tom Watson from the University of Sydney was invited to be interim dean. Watson's understanding of the university sector would prove invaluable in the amalgamation negotiations.
We reached a point where Melbourne just wouldn't move, and I remember very clearly we walked outside the gate into Royal Parade at Melbourne, and I said to Tom, "What are we going to do? This is just going on and on and on." He said, "What do you think we should do?" Well, I said, "I'd like to try Monash."
By this time, I was Deputy Vice-Chancellor at Monash University, and Mal Logan, the then Vice-Chancellor at Monash, said, "What's the problem?" And I said, "All they want is to be seen as independent and prove that they can do their own thing." And Mal Logan said, "Is that all?" And within a couple of days, it was all over.
The state education minister was reluctant to accept it, and there was a strong campaign mounted by the pharmacy profession in Victoria to support the move to join Monash. Because it was such a long-standing solo institution teaching pharmacy in Victoria, it had that enormous support.
In 1992, the Victorian College of Pharmacy and Monash University amalgamated. Retaining the Victorian College of Pharmacy name, it became the first standalone faculty of pharmacy headed by its own dean in Australia.
They proved the point that they could sustain themselves as a full faculty with undergraduate teaching, postgraduate teaching and an international reputation.
Back in around about 1997, and this is one of the real benefits of joining Monash, we were able to extend the pharmacy course from being 3 years to 4 years, and we built in a lot of clinical experience. And then we relied heavily on the profession to provide the sites and the experiences for the students going through the pharmacy program.
Study and research in pharmaceutical sciences were becoming an increasingly important part of the faculty.
When we teach a pharmacy program, a lot of what we teach in that course is all about formulation, formulating drugs. And the same principle of taking a raw material to a finished product applies equally to cosmetics or agricultural chemicals or food or paints or all those types of things.
The Bachelor of Formulation Science and the Bachelor of Medicinal Chemistry began, reinforcing the crucial links with industry. Over the years, the faculty had graduated numerous alumni who were staunchly committed to the profession. Connecting directly with these graduates was vital.
We need to have a foundation established whereby if people are feeling philanthropic, they'll think of the Victorian College of Pharmacy.
It provides a touch point for alumni. It allows the broader profession to share that exciting journey that we're on.
Yet again, further infrastructure was necessary to support the growing local and international demands on the faculty. And so, in 2005, the first soil was turned in what had been for many years a staff car park and a student kick-to-kick area. Higher education was increasingly in demand, so the Postgraduate Studies and Professional Development Unit was formed to consolidate and develop the existing courses. The faculty's research was drawing international attention. In 2008, the Monash Institute of Pharmaceutical Sciences was established to design and develop better drugs. With strong connections to industry, MIPS drew preeminent pharmaceutical scientists together in Australia. The Centre for Medicine Use and Safety was also formed for the increasingly important research into medication management and patient safety.
This is a fantastic achievement for what was once really a tin pot little college.
Yeah, small independent college.
Independent college, yeah.
We could never have done any of this without Monash.
The public need to know about what a great entity we've got here in Parkville. Not in the USA or England or wherever, it's here. It's our own organisation which is just going to grow and grow and grow for the betterment of the community and for the betterment of this country.
With plans underway to further develop the campus, the resolve of the college ancestors to champion the profession of pharmacy has been more than fulfilled. The future of the Faculty of Pharmacy and Pharmaceutical Sciences has never looked brighter.